You want answers? I think I'm entitled. You want answers? I want the truth. You can't handle the truth.
We are the Mad Men of Masculinity.
Your home for healthy masculinity. We're just real men having real conversations for you.
Good day, Mad Men Mafia.
Right, I am Kirk M. Samuels.
And I am Jason B. Kendrick.
And we are the Mad Men of Masculinity.
That's right. We're just real men having real conversations for you.
This one right here is for fellas of a certain age.
Well, why gotta be a certain age?
Well, because we're all a certain age,
Well, that's true. We are a certain age, but when you
single
say
one
a
of us
certain age, you're usually referring to us of a more advanced age.
See, maybe you go getting all sensitive again. No way, man. No, this is real talk. This is what we need to have.
Yeah. This is the one of those things where we don't really think about it until usually it's too late. It's almost up there with like funeral plans and things. Like, we're all aging, like he said, person of a certain age, man of a certain age. We get to a certain point, we need to be thinking about these things. And tonight we're gonna be talking about sexual health, mainly for men, but we will be talking about even sexual health for the ladies, because they need a little support too as they get on.
Hey, man, all the dots connect, dude. All the dots connect. None of us live in a silo, but we got a guest.
We do have a guest. We have the man. This is his third round, so I guess he still likes us. But he is coming back on the show with us, Mr. Dr. Lee Moorer.
All right, what's that?
Hey, gentlemen,
my man.
Thanks so much for having me back. It's really an honor. Thanks so much.
Hey, man, thanks for joining us on here. Thanks for who you are, what you do. This ain't even our first conversation with you, my first conversation with you today, because you're not just some schmuck that we just kind of stumbled across in the alley. You're a guy that we know, that we trust. We trust with our physical health, personally, specifically. I personally trust you with even my wife's physical health. So you're one of the real deal guys, man. You're the cornerstone of what used to be Castle Rock Men's Health. Now you're transitioning to Castle Rock Hormone Health. I mean, man, you got locations and franchises all over. I think even out of the state, right? I think you cross the state lines these days, right?
Yeah, first of all, it's an honor and a privilege to be able to take care of you and your family. That's an ancient bond that I don't take lightly. We have, I believe we're up to 14 or 15 total locations. We're open in Florida, in Georgia, soon to open in Pennsylvania and Texas. And of course, we've got multiple locations in Colorado. So we're available via telehealth, really across the country. I believe the only states that have revoked the COVID pandemic ability for me to sort of transcend state boundaries are Mississippi and California, and so otherwise we're available.
Yeah, that's awesome. It's so nice to have the opportunity, and like we were just mentioning before you came on, that you get to a certain age, you need a little bit of support, and it's getting to the point now we need to have this conversation more often for men and women, so that we can demystify, we can take the stigma off it, and just let everybody know that your life can be better with a little bit of support. And that's what you do, and that's why we love to have you on, because you help us out personally, but also you're spreading the word nationwide and helping as many people as you can. So one, thank you, but two, let's get into, because I know you have the numbers, you have the knowledge of what are some of the issues that you find that you help with the most when it comes to like men's sexual health, women's sexual health nowadays.
Oh man, that's a really great question. I think you said something in the intro that really resonated for me, and so let's just sort of put it into perspective for the listener about maybe what's problematic in mainstream medicine today. So let's say we could take a bunch of examples. I've got all of them. But let's take the example of you hurt your shoulder when you're 30 years old. And you go get, let's say you get an MRI and it says, oh, you've got just a little partial tear of your rotator cuff. What ends up happening is you'll see the surgeon, he'll say, we can't operate on it. And so you do physical therapy and ibuprofen, and then maybe you get a steroid shot, and you kind of suffer intermittently or constantly with this shoulder until it completely tears in 10 or 15 years, and now it's fixable. And so what I would say is that gulf between when it happens and surgery, there's not much going on in the medical industrial complex for addressing that problem. And so what I ended up doing regarding orthopedic injuries is I went, and you guys can go check it out. It's called the Interventional Orthobiologics Foundation. And we started looking at things like PRP and stem cell injections to not only bridge that gulf, but maybe take surgery away altogether. Now let's talk about sexual performance. What ends up happening? If you look into the medical industrial complex, once again, you start having performance issues. Let's give it 35 again. And you pretty much have one option, which is something like Viagra or Cialis, until the disease gets so bad that a urologist is going to do surgery and put an implant in your penis. And so, what I'm up to once again in this conversation is what are some things we could do along the way to slow the progression, reverse the progression, reverse the symptoms. And I think that might be what's worth talking about. And I've babbled on. I hope I got into your question a little bit.
Yeah, absolutely. I mean, I think it's worth us saying right now, right up front, this is a grown-up conversation. And we plan on having this conversation like seriously. This ain't, just a bunch of frat guys giving wedgies and being vulgar and all that kind of stuff. Because I think, of all of the parts of who we are, our sexual being is just as important as every other part of who we are. Whether you're, and this ain't a morality thing or nothing like that, because you could be, the most deeply, long-term married person, anywhere, but that still should be part of your relationship. Part of your relationship building, part of your intimacy is your physical connection, and your physical connection, taps into and deepens, your spiritual, your emotional, just your intimacy period. So, these topics, can be taboo to cover, but at the same time, I mean, it's something that's universal. So we're going to have a grown-up conversation. And if you don't want your kids to hear, again, not going to be vulgar. This is going out over FCC airwaves and all that kind of stuff. And we also don't want to get banned and kicked off and all that kind of stuff. But we're going to have a real conversation. And this is a medical conversation. It maybe even will get, kind of deeper than just the medical stuff. But so I think it's worth just, putting that out there right up front. That we plan on getting real as we always do. But to your point, Doc, just that time in between, where you can have your relationship, if you're in a relationship, you can have your relationship affected by this aspect of your life that may not be to where you would like it to be, and may not be where it was in the beginning, and they can all have a domino effect in terms of the rest of your relationship.
And to give some power to your comments about let's have an adult conversation, a couple of quick statistics, National Institutes of Health type of statistics, 50% of all adult men suffer somewhere on the spectrum of what's called erectile dysfunction, the definition of which is a little bit complicated, but we don't really need it's if you are having difficulty getting a firm erection to do your manly duty or do have the sexual encounter fulfilled. That's loosely the definition. A few more, 60% of those are in our age group. And here's the scariest part is that 80% of all those suffering from it can't even have a conversation with a healthcare provider because they're either too embarrassed or the healthcare provider's too embarrassed. So we're talking about, I don't want to ever get too over the top, but that starts to sound like, epidemic level numbers.
Yeah, I mean, I and the point you just made is so key that these conversations don't get normalized to the point where, even to the point where a guy can walk into a primary care doctor, for example, and say, "Hey, this is, I'm having these kind of issues," because you're right. I mean, we don't even feel safe enough to talk about it. A lot of us, a lot of guys that go through this journey feel like they're the only one, and there's a lot of identity, maybe even some ego, maybe even some self-worth, all these other kind of things tied to it, that it can be embarrassing. So that, that's kind of what we do in here, man. We have conversations that don't normally happen, publicly. And, oh, by the way, if a guy is in a relationship with a woman and, it's not working on one side, that probably means either, there's either a collateral impact to her, or at the same time, maybe there's some things on her side that, the engine ain't revving like it used to be, et cetera, et cetera. And so, I mean, there's all these collateral issues that a lot of people don't feel safe enough to talk about.
Yeah, it's one of those things that I think we should, since we got you here, Dr. Lee, is talk about, maybe even give them some statistics to let them know. Because most guys, like Kirk was saying, the ego gets in the way. They don't want to feel like less of a man because they're having this issue. They're supposed to be able to get up whenever they want to. But with all the estrogen in the water, all the plastics, all the different things that are affecting men's testosterone, maybe if we talk a little bit about that to let them know it's not something wrong with them. It's just like you said, maybe this epidemic of all these other issues that are causing these issues.
Now, I know Doc enough to know that the 15, 20 seconds that we have before this next break ain't enough for him to answer that question. So,
I'll just say, Jason, you're right.
I know him well enough. We're gonna handle that.
We'll come back to that one.
Yeah, we will come back to that one because he about to throw it down and he about to drop it like it's hot, and he needs more than a few seconds. So we'll handle that on the other side of this break. We'll be right back. Mad Men of Masculinity. Yeah, I was like, oh man, that's a loaded question right there, man.
Oh hell.
We about to release the Kraken.
Well, I mean, that's what we need to do. We need to make it known that it's not like a just your personal issue. Like there's so many other factors that are affecting it. So the other guys go, oh, maybe I do need to go get checked.
Right.
Yeah.
So, cool. All right. Here we go.
And we're back.
We are back. Mad Men of Masculinity, KLDC 12:20 a.m. in the Mile High City, on the interwebs everywhere, madmenradio.com, Facebook, YouTube, holler at your boys, all that kind of good stuff. We talk about the real stuff. We don't talk about the fluff. You don't find a whole lot of guy conversations about stuff that guys need to talk about, and that's what we're doing on this bad boy.
Well, so since Kurt cut me off because we didn't have enough time, let me reset up. Let me pitch this pitch again.
Yeah, throw the pitch again and let them knock it out the park.
So, Dr. Lee, I know we had mentioned about 60% of men, especially in our age group, having issues with testosterone and ED and things like that. But there's so many other factors. I want you to talk about the factors that are leading to men having low testosterone and ED issues that maybe not have anything to do with them, so they can feel less like they have an issue, more like there's systemic issues that are causing it.
Oh, great. Let's unpack this a little bit. So from the top, let's start with sort of guys in the 40 to 60-year-old age group. One of the things that we're seeing, and you can kind of see it all over the place right now, it really started to blow up. There was a brother-sister team that went on Tucker Carlson and then went on Joe Rogan. I don't remember their names, but I'm really impressed with what they're doing. And what they were talking about was all of the terrible food that we've been eating and all the environmental toxins that we've been eating have created sort of this epidemic in our age of metabolic syndrome, prediabetes, type 2 diabetes, hypertension, hypercholesterolemia, all of which are really social diseases from eating bad food, not working out right, stressful life, toxic environment. And so if you look at classic erectile dysfunction, from now on, I'll just say ED, you find that about 80% of that is vasculogenic, meaning the penis is kind of a microcosm, if you will, of the full body. And so if you see guys our age starting to have atherosclerosis of the arteries in their heart, right? Well, those arteries are a lot bigger than the arteries in your penis. And so if you think about the radius of those vessels, if you have a smaller radius, you'll have a bigger impact of that atherosclerosis in your penis. And so there can actually be a vasculogenic cause of that. And then we can talk about how to deal with that afterwards. Then, of course, you have neurogenic causes. If we have people on the call that have, Alzheimer's, stroke, spinal tumor, that's kind of hard to work around for cures or interventions, but they're there. And then, of course, finally, you have what's really important for us to talk about, which would be performance anxiety. We call it supratentorial is the doctor's word for it, but kind of it's all in your head. Or endocrinologic, meaning low testosterone, which of course needs to be evaluated. Now let's unpack the younger generation, because it's quite scary how much erectile dysfunction I'm seeing in teenagers, 20-something, early 30-something. If you were sort of a fly on the wall at the clinic, you'd be like, holy cow, is our species even going to make it? So that's really more of sort of the, first of all, performance anxiety, the low testosterone. And what you were getting at is that there's some interesting work going on, not enough. And I've put together a foundation to study this. I just haven't. There's no money in it. But anyway, maybe one day, we'll get some really rich donor to give a call to the Mad Men and get this party started. But there's an interesting recent publication from a urologist at Duke. And while he was doing surgery on men, he took a tissue sample from their penis and analyzed it, and it's loaded with all kinds of microplastics. And so what Jason was bringing up at the initiation of the question is, we've now got these younger generations that have been exposed to microplastics from breathing in brake dust, from drinking plastics and water, from microwaving food. We've got xenoestrogens, which are sort of weird estrogens that engage with the estrogen complex in the cells and activate them. And so we're starting to see interesting social phenomena with men not necessarily acting like men and women not necessarily acting like women. And maybe we don't want to engage in that conversation, but I can tell you that I'm curious if there's not some sort of medical reason behind that conversation that no one wants to talk about right now because it's a political third wire or third rail. So interesting. To sort of sum it up, we've got lots of reasons why we may have this increase in ED across the board in all ages. And really thanks for bringing it up, just to bring some awareness to, if this is going on for you, for goodness sakes, let's get it looked into.
Yeah, I would almost hesitate. And again, this is experiential from myself in terms of over the course of my entire life. I would throw another factor in there of massive quantities of internet pornography consumption.
I'm so glad you mentioned that.
I mean, yeah,
It's the truth.
I would throw that in, especially for the younger generation. But I mean, just massive quantities. You know, I got to think, you know, whatever factors would that I could throw in there as well.
No, I really appreciate you bringing that up. I know that's kind of like one of your things. It's definitely in my list of recommendations. You know, if you look at how if you got scientific and you looked at how the body works to go from erection to ejaculation to afterwards, dopamine is such a gigantic player in that. And what's essentially happening is internet porn or porn addiction causes so much dopamine release that I actually have a patient that I got started on GainsWave treatments last week who has a porn addiction, and it's just, I mean, disastrous what he's going through with divorce. He and his wife haven't had sex for a year, and it's the problem these guys have with the porn addiction is that they can't get that same dopaminergic release as they can with another human. And it can even go so far as the actual mechanism of the strength of the fist versus the tensile strength of the vagina. It's just not relational, meaning it's just not the same. I know I'm preaching to the choir here, but so you've got chemical issues, you've got the frequency issue, the visual issue, and then really the tensile strength of the hand. Even I'm actually maybe you may have to edit this segment, but because I'm in complete agreement, Kirk, and I know you've had shows before where you've preached the gospel of the negatives of pornography and maybe even self-stimulation.
Yeah, I mean, and you know, and we're at some point we will get to some of the solutions to all of this, especially in terms of a lot of the a lot of the services that you provide and all that kind of stuff. So right now, obviously, we're just kind of laying the groundwork. But you know, I always use myself as an example, and yeah, it's really hard to set a natural baseline for human sexual enjoyment when the mechanical stimulation, the over mental stimulation, the just the quantity, I mean, all that kind of stuff, the baselines that it created for me in terms of my addiction in that arena. So anyhow, I just wanted to not to derail the whole conversation, but when you listed all the factors, I mean, I just social, especially when you talk about young people, I mean, they all have these, and I got a son. I mean, and I know what what that generation, especially of males and these days of females as well. But I know the massive quantities that they're consuming, and you can't consume anything in massive quantities and expect your body to act naturally. It just is what it is. So I mean, again, all of these are great topics to talk about. Shoot, me and Jason are seeing the little likes on here, and people are even chiming in on this video here. So
Great.
Yeah, if our producer has to go back and edit some of this or bleep out whatever, so be it. I mean,
so be it. I can handle it.
This will be an important topic.
Yeah, it's just one of those things that we need to shed the light on, because so many people, especially in the States, we're so puritanical or whatever the word is, where we want to keep it behind closed doors. We want to keep it so secretive and we don't want to talk about it. And then it affects our lives so much because it's such. I mean, it's one of the four main wheels on our vehicle of life, and we just ignore it until it goes flat. And then you go, "Oh, somebody help me," and then we don't look at the cause. We only look at the effect, and then we medicate the effect, or we put a Band-Aid on it. Or sometimes, to even Dr. Lee's point, you go to a doctor and they're like, well, you either can take this medication or you can wait till it gets really bad, then maybe we'll do something. Otherwise, oh, that's just the way it is. You're old now.
And that's the dope part about you, Doc, is that your whole thing is you don't have to, like, there's a lot of things that have been things that you just got to deal with. But nowadays, you don't necessarily have to deal with it. You don't have to necessarily just accept the fact that your testosterone is going to go down as you get older. You don't necessarily have to just suck it up and accept it. I mean, et cetera, et cetera. There are things that you can do. There are things that you can do, to your point, that canyon in between, or just that space in between.
Shall we jump into that? How much time before our next break?
Like
30 seconds.
The natural ways to deal with this. I want you guys to always think about the caveman, cavewoman lifestyle. And what does that look like? Well, we used to go to sleep when it got dark and we'd wake up when it got light. So we weren't doing electronics till 10 o'clock at night. We were sleeping 10 to 12 hours a night. We were getting out all day in the sunshine and we were exercising vigorously. We were eating right. And so that translates into the modern day with get great sleep, minimize electronics, vigorous exercise regularly, eat caveman types of stuff like meat, fat, veg, ditch all the crap, and then natural sexual encounters, not having sexual encounters with electronics, supplementation. When you vigorously exercise or even have a really good stretch, you release nitric oxide throughout your whole body. That's a vasodilator. Even that can help with erectile dysfunction. So go natural always before going to see a doctor is my hard advice.
That's awesome.
So let's go.
No, hard advice, no pun intended.
No pun intended. Speaking of going natural, we better naturally take ourselves to a break.
Yeah, we will. We'll be right back. Madmen of Masculinity on KLDC.
Look at that instinctual timing.
I'm telling you, man.
I hit that 30-second boom.
Bring it on it, dude. Bring it on it. Like right on that thing, man. Yeah. It'd be dope to get into some of that stuff. I'm gonna use myself over this past week as an example, as a lead-in.
Bro, you know what I was gonna say? I've done a little mini study where when I have sex with my wife without any pornography or masturbation at all, it's so much better than if I get into masturbating. Even if I'm masturbating about her, it degrades the sex.
Yeah.
I think masturbation is healthy if you're like Jason and you don't have a steady. But when you got it there, it can be destructive to the relationship and to the sexual performance.
Absolutely.
Yeah, that's something we should mention too, because I know I heard it from one doctor. I think he let it slip accidentally, but about regular ejaculations helping the prostate health as you get older.
Yeah. I don't know I don't know if that's published data. I've heard it. I believe it. I think you got to use it or lose it. I can tell you I've been using a penis pump as part of the Gainswave treatment. Man, I've gotten a 1/2 inch in length. I mean, that's insane.
Yeah. Well, I'd love to talk about the Gainswave stuff, man.
It's amazing.
Maybe that'll be the icing on the cake here at the end.
Yeah, sure.
Right.
Sort of sounds like a commercial, so I'm a little scared.
No, man.
Right.
I mean, I'll set you up. I'll set you up good. It won't be you.
If they don't know about it, they need to know about it.
Yeah.
We're not the only ones that have it.
Right. And, I mean, but these are stuff that people don't even know exists. Yeah. Like, wherever you get it, if you don't know it exists, you ain't gonna go get it nowhere. But it could be.
And it's kind of like COVID. One pill didn't work.
Right.
You had to do like 4 different things simultaneously to get the party started.
Yeah.
Mhm.
All right.
And same with ED. You got to do it all. One thing's not going to work.
Let's get this party started. Here we
All right, let's do it.
And we're back.
We're back.
Mad Men of Masculinity, KLDC, 1220 AM in the Mile High City on the interwebs.
Everywhere.
Real talk. Dr. Lee Moore around doing our thing.
Yeah.
He's our guy. Totally breaking all the paradigms, all those kind of good things. And
yeah, make sure you put on your big boy pants because this is adult conversation. So
I like to. I'll use myself as an example, so I don't have to put anybody else's business out there. Kind of. I'll be the subject, but not the message. How about that? I just had a week in Jamaica with my wife, and we went back to where we got married. And this little anniversary thing. It wasn't until we got down there that I realized how good I felt walking around with no shirt on. It wasn't until we got down there and disconnected from the world and just being us. My wife and I had some of the most amazing sex all week long. She was getting it. She was so anyhow.
But there's some caveman stuff there that you're leaving out because we talked about this earlier today.
Yeah. So
you were hitting mad meat and veg.
Dude, the whole lead up to all that is, over my time with you, man, I've got my health in line. I've got my testosterone in line to where it should be. I've gotten into the gym. I've started to work on, all these things. And then when I got down there, it was time with my wife. It was intimate time and it was freaking fantastic. But a lot of that comes back to, again, some of the things with you in terms of getting me physically in better places where I could multiply or amplify the intimacy or the environment that my wife and I found ourselves in. And so, it is one of the foundations of, one of the ingredients or one of the legs on the stool, whatever you want to look at it, for men, I'm asking a question I already know the answer to. Talk about hormone health in terms of a men's sexual health.
And just to put a little bookend on what Kirk was saying, we're not talking about a lot of expensive doctor's visits or, some craziness like that. We're talking about the fundamental stuff. We're talking about, moderate to exertional exercise, moderate to severe amounts of sleep, moderate to severe stress reduction, eating good meats and fats and veg, supplementing, red light therapy. I'm a big fan of it. We see good benefits from that. So those are, so Kirk was saying, what about hormone optimization therapy? If you're experiencing erectile dysfunction, ED, the very first step is a hormone panel. Even if you are already treating and you think you're getting a good service from a mail order place in Florida that never checks your labs, it's worth taking a look at all the different hormones, at a blood count. Are your kidneys and liver okay? Is your blood pressure okay? These kind of things should always be included as a first step, in hopes that if abnormal, normalizing those or optimizing those will slow, stop, or reverse the severity of the dysfunction, of the sexual disoptimization, however we want to call it.
And that goes for a man and the woman, right? Because left out of that equation, my wife has gotten hers optimized, and we've already had that conversation.
Oh, yeah, and this is for absolutely for women. They're having we talked about these plastic epidemics. And there's something else that I'm seeing that's not been published. What you find is when you're the doctor that's out there, on the front lines, you see what's going on 10 to 20 years before it becomes mainstream. And what I can tell you without going into too much detail is that women are experiencing extremely low testosterone levels because of synthetic contraceptive hormones, because we're all eating the equivalent of a credit card of plastic a day. That's eating, drinking, or breathing. These women are suffering greatly for this. And then you take into consideration they're having babies and getting stretched out and or torn, or they're having uterus prolapse, or they're having incontinence as they get into menopause. They've got a lot of issues that also need to get looked into. So we definitely can't leave them out.
Yeah, I think all of those factors, I mean, involved in, and like I said, I mean, I've noticed, just personal example, I've noticed, a difference in my life personally, and my personal self, but then my relational self, and then my, again, my connection with my wife. And yeah, we're down there eating just meat and grilled veggies, and we get out in the sun, getting vitamin D. We're getting to, just down there time, looking at her, she looking at me. I'm walking around all shiny, sexy chocolate. All the or whatever. She's looking at me, I'm looking at her, but anyhow, great example. So from a hormone level, at what point does a guy need to look at some sort of medication or some sort of pill or something like that?
Well, I'm glad you brought that up, because essentially, if there is some ED, the first step is a hormone optimization panel. That will take care of quite a few of them. The second step is sort of at the same time as we look into things like these things called PDE5 inhibitors, which are your tadalafil, sildenafil, your Viagra, Cialis type of thing. There are some supplements that I've found helpful in patients and in myself that help to relax smooth muscle, release nitric oxide. You guys, please feel free to go look at this yourself. You don't need to see me about this. You can. They're L-citrulline or L-arginine are naturally occurring amino acids. There's some plant-based stuff like yohimbine I've had a lot of success with. So there's those kind of things. But the interesting thing about like Tadalafil, Viagra, Cialis is we have a big quiver of compounding formulations we can play with. For example, I've seen guys that have a problem with premature ejaculation, meaning they're orgasming before they would like to. I've got a formulation for that that's incredibly successful. There's some guys, there's some couples that have connection issues, let's say maybe from previous trauma. And there's really interesting formulations with apomorphine and oxytocin in them that can help. Oxytocin is when a woman's breastfeeding, it causes the milk to get let down. But there's a side effect of that milk let down, and that is the oxytocin creates a connection between mother and baby. And so when we give men and women couples together, this formulation, they lose that in performance anxiety, inhibitory problem. So this is a lot of fun. And then of course we can formulate a little tadalafil or Viagra in there for both sexes to keep the party going or make it longer and stronger. So we play a lot of these games, and these compounding formulations are I think quite reasonable, somewhere from $8 to $10 per encounter. you know, far cheaper, I guess, about the same amount as putting the quarters in the heart-shaped bed that shakes. That I don't think that's quite as effective. So we've got a lot of options pharmacologically.
Well, and that's one things why we love having you on, because I think there's so many people that just kind of white knuckle it and they think, oh, I'm just getting older, or maybe we've been together so long that we just don't find each other attractive anymore. And now we're just roommates. We're not, this, that. And they don't look into other options, holistic options, even hormone options, to say, well, maybe it's not that we've known each other so long that we've just kind of gotten too stressed out, or other factors in our lifestyle has made it so that our hormones are off. So that we're missing these things that helped us to connect initially. Can you talk a little bit about that?
And yeah, and I think I'm going to answer the question. I hate to talk around it, but it really, one of the things that I have a big problem with the medical industrial complex is if you come in with a symptom, they give you a pill. And where I see that most often is somebody comes in anxious or mildly depressed, and they give them a pill. They give them a depression pill. They're called SSRIs. You've heard of them: Paxil, Prozac, etc. And if you look at the side effect profile of an SSRI, top of the line is erectile dysfunction and ejaculatory dysfunction. And the reason for that is serotonin increase decreases the ability for either sex to get aroused. And so we're over prescribing and over diagnosing this depression, anxiety issue. And it's because doctors no longer feel, or maybe they never felt, like they had the time to talk through issues and counsel. They just want to throw a pill at something because they make, sorry to tell you guys, doctors make more money if they prescribe you something than if they don't. It's a cheaper code if there's no pill prescribed. And so that is really, that I would say, I don't know, half of everybody that I see that comes in with an erectile dysfunction issue is on this loosely quoted junk that is being prescribed. And I'll tell you one last thing, Jason. And other doctors will confirm this, it's almost impossible to get someone off of this stuff once they've started on it, because it's a big pharma addiction. It's a forever prescribing situation. And so unless you're, severely depressed, suicidal, or homicidal, and by the way, these pills, another side effect is worsening of suicidal ideation. I guess don't get me started on big pharma, but this is a real big problem. Is there are some, and there's blood pressure pills that can cause erectile dysfunction, and blood pressure in large part is a social issue. It's, you guys all know, there are 5% of people that actually have hypertension diagnosis that's not socially connected, but it's eating poorly, exercising poorly, too much stress, not enough sleep.
Well, that's how we're going to end this last section for the moment. You can let Dr. Lee go on a rant, and we, as a Mad Men, will be right back on this episode of Mad Men and Masculinity. We'll be right back.
I don't even know if I answered your question.
No, you did. But you know what? Actually, Jason, that was a good point. And I mean, obviously, we're still streaming, so anybody can hear this part. But I think, relationally, there can be just kind of I think over time, you can begin to see each other as just the other person on the other side of the bed, and relationally, and, when you get life involved and stress and all this other kind of stuff. And if she's hot flashing and he's, he's got man boobs, I don't know, all the things that just, it's harder to begin to see each other where you want to have physical connection, especially again, when life just gets in the way and all this other kind of stuff, it's hard to keep that fire going, especially if you're not overly intentional, and even Doc, when you talk about the oxytocin stuff, when you throw stress factors in there, the cortisol increase has all kinds of other physiological, impacts on your body, and oxytocin is one of those things that kind of has better effects or the more opposite effects than cortisol. So.
But yeah, what if she has sciatica, or what if you have knee pain?
Yeah.
I mean, pain can get in the way. Kids can get in the way.
Man.
When my kids are home, my wife's not interested at all.
Yeah.
And now all of a sudden, one of them's homeschooling, and I'm like, oh,
no.
And again, back to the vacation example, I can honestly say that, especially with all the health issues that my wife has had, I felt coming home more connected and more emotionally attached to my wife than I did when we landed there. And it's just because of the fantastic, week that we had. And so a lot of those factors, those relational factors do get in there. And it's important to address some of these things because they can add on to all that and kind of get in the way of the connection between them.
I do a large level of counseling around this, in large part because we have a membership thing, so I can spend as much time as I want with anyone. But I talk a lot about, guys, we're kind of like, I'm going to solve this problem, and then we'll move on. And women like to talk through things. And so a huge connection thing is honestly just sitting on the bed every night and the guy freaking shut your mouth and let her talk whatever she's got to talk. And then she's got to shut her mouth and let you talk whatever you talk. Get your day out there in the open, relieve the stress, get the connection. I don't know how much that's happening because when I mention this, it sounds like crazy town.
Yeah, it's cheap. And so some of all of this is the sociological, the relational aspect of it, and there's also absolutely the physiological aspect of all of this too. So but when you brought that up, Jason, I was like, man, you're so right, because after a while, man, the other person can just become, the other person when life just gets in the way, family, kids, bills, work, all that kind of junk. So what do you got? Like earphone issues or what?
Yeah, my phone rang and it connected to my headphones and then kicked me off the computer. So hang on, I can be connected.
Yeah, we're gonna give Tanner some good editing. We're gonna give our producer some good editing on this audio over the year for sure. But
I think you always got to be regenerating too. I think as a guy, you've got to always, like, I wake up every day and I'm like, I got to create that I'm thankful and grateful that she still puts up with me.
Yeah.
And I think all couples need to regenerate frequently, if not daily. Otherwise, you can get stuck in this poor, pitiful me. I'm a victim. Why am I in this? She's not as hot. I'm going to go look for something younger.
Mm-hmm.
I think that's just that's worthless. It's wasteful.
Yeah, it absolutely is. And so again, at the core of all this is why I think, man, your physical, your sexual health and relationship is huge.
Spiritual.
I've been spiritual. I've been I've been in a sexless marriage before.
Me too.
I've been in the gone 6 months and all this other kind of crap. I mean, and there were a lot of factors, and that sucks, man. That's no way to live, man. I mean,
bad for everybody.
It is, man. I mean, the world ain't a happy place when you got couples that are just that are just roommates. That sucks, man.
Yep.
It's big time. You figured that thing out yet, or what, man?
I don't know what's going on with my headphones. I'm gonna have to go with the audio off my laptop. Hopefully that doesn't mess up with the microphone. But
we got one more segment here. My pre-workout's starting to kick in. I can feel my face itch.
Yeah.
I'm about to go have International Chest Day here.
Right on. All right, well, let's get it knocked out. I'll go ahead and I'll mute myself when I'm not talking, and then we'll.
I don't hear the echo when you do.
Sounds good to me.
Yeah, I
Okay.
think it blocks it out. So I think it'd be
All right,
good.
perfect. Well, let's go then.
Yeah, let's finish it up. And we're back.
Yes, we're back.
We are back. Mad Men of Masculinity. This is real talk right here, man.
Real talk radio.
If this is us on the radio, you need to go check out the conversation on YouTube and Facebook, because we've been getting deep on all the stuff that is not FCC worried about.
Approved.
We've been getting pretty real on this thing, man. So one of the things, Doc. Now this one, you already talked about like people that got to get implants and all that kind of stuff. But I mean, and so in talking about before leading up to that, this topic, man, this thing I'd like to dip a toe in is I don't even know that a whole lot of people know that this stuff exists. And again, I mean, however we can word it creatively, I don't know. But talk to me about shockwave therapy.
Oh, this is going to be
but before you go there,
yeah,
I want to preface that I mean, I am totally I'm fishing. I mean, this is a service that you provide, but I'm totally setting you up. This ain't you trying to be the carpetbagger sales guy. But this is a topic that once I heard this thing, I was like, yo, this is like some this is some new and PT 141 peptide, all. But these are stuff that people don't even know that's out there. But talk to me about shockwave therapy.
Well, I really appreciate the intro, and this is actually going to be a really interesting way to sort of wrap the beginning to the end and put a close on this. And yes, full disclosure, I do offer these offerings and/or procedures, but lots of people do. So in the beginning, we were talking about that shoulder, and to the in between the diagnosis and a surgical repair was regenerative therapy. And so, believe it or not, guys, one of the things that is out there, and you can search this on YouTube, the internet, they won't show the procedure, but you can hear from people that have had it, is what's I'll call it regenerative therapy of the penis, because there's a trademarked word for it that if I use it, you guys might get in trouble. But essentially, what if you could take PRP and or stem cells, and just like the shoulder, you could inject it into the penis or the vagina and around the clitoris to do regeneration. And it's really exciting because what it's doing for younger guys is it's slowing down, stopping, or reversing ED. What it's doing for older guys with ED is reversing that. So if we let out in saying that vasculogenic is the leading cause and atherosclerotic plaques in those arteries, if you inject regeneration into the penis, and then you also need to use a penis pump to continually to micro injure the penis to attract your own stem cells to the penis, you can regenerate potentially or proven those arteries, veins, and nerves in the penis. So that's a great idea. It's something I do frequently. I've had done. The procedure sounds scary. You can numb the penis up to where you don't even feel it. And then the other thing that I think is even more successful, but done together, is hugely successful, and that's shockwave therapy. The trademark for that is Gainswave. I can say that because I pay to have a Gainswave device in my facility. And essentially, it is shockwave therapy. This all started in the Submariner community on how to find that torpedo. And then in like the 50s, we started looking at kidney stones with it with ultrasound. And now we're therapeutically shocking the penis and the vascular and neurostructures down closer underneath your scrotum and near your anus to regenerate the arteries that go to the penis and the nerves that go to the penis. And that plus, and what I was also telling Kirk and Jason is when we had the pandemic, what we learned is one thing doesn't work. You've got to take 4 drugs. And when we attacked HIV, it was 3, 4 drugs. And when you've got this ED issue, it's not one thing. It's lifestyle, testosterone, supplements, Viagra, penis pump, Gainswave, P-shot. It's all of it. So I think that's a nice way, at least for me, to, in my mind, close the segment out and say, why wait till a surgery when there's all this that can be done to keep from ever having that surgery potentially, and
that's
get your
something
function and your life back.
Well, and that's, I think, since we have you and you are a true, authentic, real licensed doctor who started out in the medical industrial complex, as you call it, maybe touch a little bit on, because so many people we've been taught, trust your doctor, trust the hospital, trust these things, but then we don't. A lot of times folks don't do any more research. They don't look at other things. They don't look at the whole picture, and they just go in and the doc says, oh, take Wellbutrin or take this thing. And then they don't illustrate the side effects. But having someone like you who's been there and then come out of that to say, hey, there are options and solutions that you need to look at maybe prior to, or even in combination with going to the doctor and having them prescribe you their pills because they get paid more.
No, I like how you mentioned a combination, a team approach, because, for example, I saw a guy last week who's having erectile dysfunction and his diabetes was out of control. His blood pressure was out of control. And so I think a team approach can happen. I think that, medical problems need to be in control. If we're saying 80% is vasculogenic, and we know for decades that the problem is metabolic syndrome, diabetes, hypertension, hypercholesterolemia. So I'm not saying don't go see your doctor. My worry is that they don't really trust that you could potentially eat right, exercise right, supplement right, get outside, do all the things that need to happen. And I trust you. I think you meaning the audience, because why would anyone ever want to go on a pill that can give you terrible side effects? I think, to Jason's question, the real issue is medical doctors and or PAs, NPs that work in the establishment only know what the establishment teaching offers. I was part of it. I know it intimately. And that offering is pharmaceutical pills or surgery and not much else. And so I think you've got to be your own advocate. You've got to do some work here. And I think you've got to really trust your gut instinct. I don't think people trust that enough anymore. I think I've heard a lot of people say that's, the God within you guiding. And I think that you need to trust your gut instinct more, please.
And for sure, I mean, I would say, to guys, I mean, we advocate for yourself. I mean, we're not conditioned from the time we're young to advocate for our own health, and and like, hey, I think women are probably more used to it, because they, they from the time they're teenage girls. I mean, it's being in a doctor's office and putting it all out there is normal. I mean, it's not normalized for us, and so for guys, we got to be willing to to say, like, hey, I maybe I need to get checked out, or maybe this is not working. Let's look into this kind of thing. And so yeah, I mean, hands down, I mean, I think that's your superpower. I appreciate being able to talk to you and work with you, and and being part of the the Castle Rock family, and like I said, I trusted you enough, not only with my health but with my wife's health. And so you the bomb.com, and we definitely appreciate it. The in terms of, and by the way, you're real. like, you know, when we did our labs before we left, you freaking called us today to go over our labs. It's not like some schmuckatelli, you know, that is in the back office that you know just got the call. Like you freaking, you know, you're it. Not only are you the face of the franchise, but you're hands on with it. And you're a real guy, and we can talk about anything, man. So I appreciate it big time.
Well, I really appreciate you guys and what you're up to here. I want nothing but the greatest success for you. Like we've spoken about off camera before, masculinity is something that's necessary. It's for our social fabric. It's kind of a a 4-letter word right now. I don't think that's right. And I think you guys are approaching it as lovingly and compassionately as it needs to be. But, you know, men and to a certain extent, women need to understand masculinity is it's a part of the human condition.
Yeah, it's one half of the yin yang. It's one half of the puzzle. It's part of all that is. And, you know, as we get down to the landing strip here, as we set up for landing with you, Dr. Lee, I know there's a lot of options out there, and I want you to be able to give a little plug, because I know why Kirk and I use you, because I've seen a lot of these other ones. There's so many other all over the internet, and you can get all sorts of different pills and pellets and gels and things like that. But to actually have you as a real doctor who knows what he's talking about to help each one of us individually to go through our numbers and our labs and to set up a program, I mean, I think that speaks volumes to how much you help us versus these other folks, and we won't name names to stay safe, but they're obviously just out there for the money.
Well, I think thanks for the plug. I think more than anything, they're uninformed. When you what my heart goes out, particularly to veterans, because often they deserve better than they're getting. A, B, oftentimes they don't have the kind of money that it takes to be in a monthly program. C, they go to the VA and they get a little bit jerked around, really because of a lack of education, a lack of understanding around this subject. So what I would say is do whatever you can do based on, your financial ability. If you come to see me, we offer a free intake and, a $1,300 lab panel that's discounted down to $150. Clearly a lost leader for the business, but we want to get in front of people and educate them. But if you can't afford, some sort of concierge level membership, do whatever you can do, guys, because this has to get addressed. Give it a try. We'd love to see you around our neck of the woods, but if you choose one of our competitors or to go through the medical industrial complex, thanks for listening, and I'm glad you took action. And I just want you to feel and look amazing, have an optimized, amazing life full of amazing experiences, love, compassion, relatedness. And so get at it, gentlemen and ladies, get at it.
Yeah, I know. Working with you, man. Within months after getting married, my wife was getting back surgery. So that speaks for itself. Is it Doc? Is it crhormonehealth.com yet?
Oh yeah, it's crhormonehealth.com. That will get you. You can choose your closest location, and that'll get you the most up to date, sales deal. We often are offering, deals on labs or whatever.
That's awesome. Jason just put that in the comments of the video here, so that'll show up on the YouTube and Facebook comments as well. So
great.
Well, I'm glad we went over a little bit of time here because our producer's going to have to edit out some stuff.
Yeah, I think so.
For the over the air, so that's okay. We'll take that. Doc, man, seriously, I appreciate you as a man, as a brother. I mean, you supported the men's summit, man. I mean, you come on here, you're a resource for us. Obviously, you put who you are, the proverbial where your mouth is kind of thing. Like you about it, man. You're true to it, and so we appreciate you, man. We thank you, and We look forward to the next time we have you on.
Thank you so much for having me, guys.
Right on. And with that, the Madmen are
out.